Right now, I would like to introduce Mary Jean Cullen. Mary Jean obviously is a Medicare consultant, has been in the benefits and insurance business for the past 15 years. At PricewaterhouseCoopers, Ms. Cullen educated employees on topics that included the full spectrum of medical, dental, and vision benefits for all age groups, including Medicare clients. To put it simply, she can cut through the Medicare maze.
Thank you, Victor, for the introduction, and thank you for allowing me to do this presentation for your clients and your business associates. What we're going to talk about today are Medicare basics, and our agenda is the following. We're going to look at the what, who, and when of Medicare, some sample costs, examples of coverage and cost, and a little bit about coordination and benefits. So first of all, what is Medicare? Well, it's health insurance offered by the federal government for individuals who are 65 and older, or under 65 with certain disabilities, or people who have end-stage renal disease. Who manages Medicare? Well, enrollment is managed by the Social Security Administration or the Railroad Retirement Board for railroad retirees. The administration of the Medicare plan is managed by the Center for Medicare and Medicaid Services. It's called CMS. I don't know why it's not called CMMS, but it is CMS. And they're the ones who actually take the law that's been instituted by the government and translate that into the administration of the actual plan. There are four main parts to Medicare. Part A is your hospitals, and that also includes skilled nursing facilities and hospice as well, and perhaps some home care as long as it is prescribed by a doctor. This would be services like physical therapists or occupational therapists. It does not include long-term care. Medicare has nothing to do with long-term care, which is more about getting home health aides or help for activities of daily living, such as walking or taking a shower, having someone to help you with those types of activities. Part A is hospitals, skilled nursing, and hospice care. And then Part B is your medical insurance. That's your doctor visits, or when you go to a provider, or you go to an ambulatory center to have a procedure done, or you need x-rays. Both A and B are like the traditional old-fashioned indemnity plans, where you have a deductible, and then you have coinsurance. And Medicare covers 80% of most costs, and then you are responsible for the other 20%. We'll skip over to Medicare Part D for a second. That would be your prescription coverage, all your drugs. If you're given drugs in a hospital, that's covered under Part A, but any other prescriptions that you take would be covered under your Part D prescription plan coverage. Now, Part C is what they call Medicare Advantage. These plans are like HMOs, which are managed care, and PPOs. They have in and out of network services. The PPOs do. You can get your services out of network. Under the umbrella of that Medicare Advantage plan is Part A, Part B, and Part D. No matter which type of plans you pick, you must always pay for your Medicare Part B. There's no refusing that unless you are an active employee who is still working, even though you're over 65 and you have employee coverage, then you do not need to pay for Medicare Part B. But once you join a plan, whether it be traditional Medicare or a Medicare Advantage plan, you need to pay for your Medicare Part B. Okay. The fifth part of the puzzle is what they call Medigap care or Medigap insurance, supplemental insurance. These are sold by private companies. They cover all the costs that are not covered by Medicare. Anything that Medicare approves, they cover the costs that normally would be assumed by you, the participant. They are standardized plans. They're regulated by Medicare. and they're identified by alphabet letters, as you see here on the screen. They have the same exact benefits no matter who the carrier is, but the difference is that they have different underwriting methodologies, and so that's why the costs can be different. But other than that, the plans all have the same features. So there are two paths you can go when you choose a Medicare plan. You can use Original Medicare Parts A and B, then you pick a drug plan to cover your drugs, and then you pick an optional supplemental plan or Medigap plan to cover all those parts that Medicare does not cover. Or you can choose a Medicare Advantage plan, a Part C plan, which under that umbrella, it has the A, B, and D option. You cannot choose both. You must choose one or the other. So what are the main differences? The difference is that the Part C plans, like I said earlier, they are HMOs and PPOs. They are managed care plans. Some may require primary care physicians, some don't, but you're required to stay within a network of providers, hospitals, other services, all need to be in network, part of that plan. For the original Medicare with the drug plan and supplemental insurance, those plans allow you to go to any doctor who accepts Medicare assignment. So you could be free to go to any doctor anywhere in the country. If you're a snowbird and you're in Florida for 3 months and you decide to set up doctors down in Florida, you certainly can do that in a Medigap plan along with your traditional Medicare A and B. The Advantage plans do give you the ability to sometimes have what they call a passport program where you also can change your doctors to go to a different part of the country, but you need to advise the plan and let them know that that's something that you want to do. It depends on the plan. And because both of these types of plans are offered by different carriers, they can have their own rules that you need to investigate before you choose one of these plans. How do you enroll in Medicare? Well, if you're already receiving Social Security, you will automatically be enrolled the first day of the month you turn 65. You'll receive your card in the mail a couple of months before you turn 65, and you'll have it ready to go. If you're not collecting Social Security, you can sign up by contacting Social Security 3 months before you turn 65. If you're comfortable enrolling online, it's very simple. Go to ssa.gov and enroll online. Or if you're over 65 because you've been actively working all this time and now you're ready to retire, you need to make an appointment with the Social Security office. They want to know why you didn't enroll when you first could have enrolled, and typically you need to provide proof that you have had coverage through your employer during the time you turn 65 to the present. You have a 7th month enrollment period when you're first eligible for Medicare, 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. This is called your initial enrollment or open enrollment. So if you sign up during the first 3 months, your Medicare will start the first day of the month you turn 65. If you turn 65 on the first of the month, it starts the first day of the prior month. And if you sign up during the 4th to the 7th months, the start date will be delayed. So you want to make sure that you get enrolled on time so that your coverage is ready to start the first day you're eligible for it. Also, if the initial enrollment period has passed, those 7 months, you may incur higher premiums for not having joined Medicare when you have the ability to do so. The next time you can enroll, if you did miss your 7th month period, is between January 1st and March 31st of each year. You'll enroll during those 3 months, but then your coverage won't begin until July 1st. So you could pay a higher premium for late enrollment. It's every 12 months you didn't enroll when you could have enrolled is how they figure out the penalty. Now, there's also what they call a special enrollment period, SEP. Say you're covered under a group plan due to current employment, you're an active employee, so there's no reason for you to sign up for Medicare Part B because you're currently working, you have insurance through your employer, hopefully, and that insurance is typically enough to cover you and you don't need your Medicare Part A or B benefits. You'll still have A when you turn 65 because that doesn't cost you anything. You're automatically enrolled in it. You've been paying for it your whole life. But Part B, you don't need to enroll in until you actually retire. You can enroll at any time you're covered by the group plan when you turn 65. But the only reason I could see for doing something like that would be if your group plan really had terrible benefits and you thought that you would do better by enrolling in Medicare Part B. The other thing is you can enroll during the 8-month period that begins the month after employment or coverage ends, whichever happens first. So say I'm going to retire on October 31st. I have 8 months from October 31st to enroll in Medicare Part B. Now I have to be careful. Perhaps I'm giving COBRA and I have COBRA coverage for the next 18 months. Well, if I don't enroll in Medicare Part B, and most retiree plans require that you do, even your COBRA plans require that you enroll in Medicare Part B in order to get the best benefits, you could then be entering that time zone where you could be penalized for not having entered the plan when you could have. So just a note of caution there. And COBRA coverage and retiree coverage is not considered current employment. You are not an active employee at that time, so you must join Medicare Part B. There's another enrollment period that's called the Medigap Open Enrollment Period. This is a 6-month enrollment period that starts the first of the month you turn 65 and join Medicare Part B, or the first of the month after you leave active employment and join Medicare Part B. During this 6-month period, you are provided with guaranteed issue, which means there are no pre-existing conditions. They're not going to look at any of your health issues. You are guaranteed enrollment if you enroll in one of these plans during the first 6 months. After that 6 months, if you wish to enroll in a Medigap plan, they could refuse you outright, or they could require evidence of insurability. You may need to answer certain health questions in order to be enrolled in one of these plans. And if you have certain health conditions, the cost of the coverage may be higher. So one would be encouraged to join during that first 6-month period because you do get guaranteed issue during that time. The last enrollment period is annual enrollment. That's on October 15th through December 7th. This is the time of year when you can change your Medicare Advantage plans, those C plans, and your prescription plans without any special enrollment requirements. If you don't like a certain Medicare Advantage plan, you can switch to another one during that time. Or if you find out that your formulary of drugs has changed with one prescription plan, or your prescriptions themselves, or the agreements that the pharmaceutical companies have with the drugstore, if they've changed, all those factors can come into play when you look at your annual enrollment options. So it's always best to take a look, and you can change them during that time. You can change your Medigap plans at any time during the year, but if you're going from a Medicare Advantage plan and you decide you don't like it and you want to go to a supplemental plan, you can only come off of that Medicare Advantage plan during annual enrollment. So you need to pay attention to those times in order to make a switch. It's always best to just double check. Should you change plans? Well, there's a lot of comparing to do at this time in order to make sure you're still in the most cost-effective plan for you. You might need to compare the new plan premiums. They may have raised the copays. They may have raised your out-of-pocket amounts for the Medicare Advantage plans. And you need to check if your doctors and your facilities still participate in the plan. Most likely they do, but sometimes they may not. So it's always important to double check that each year. And as I said, for the prescription plans, the tier and formulary changes could make it more advantageous for you to switch to a new plan. The actual cost of the drugs, the premiums themselves, and what you're taking could change. So those are all good reasons to look at your plans and make sure whether or not it would be helpful for you to change them. Of course, then they would be in effect on January 1st of the next year. So let's take a look at the costs. How much does Part A cost? Well, basically it's premium free if you and your spouse paid Medicare taxes while you were working, and typically 10 years or 40 quarters. That's what's required, and most people do get Medicare Part A for no cost. You can purchase it if you're 65 or older, if you enroll in Part B and you meet citizenship and residency requirements. So how much does Medicare Part B cost? Well, for those who are already collecting Social Security, it's $104.90 a month up until the end of 2015. For anyone joining Medicare in 2016, it's $121.80 a month, as well as for those current Medicare beneficiaries who are not collecting Social Security. Those with higher incomes are subject to adjustment amounts. They call it IRMA, you might see that, income-related monthly adjustment amounts. And the IRS uses the tax returns from the 2 previous years in order to come up with the figure for your Medicare Part B. So in 2016, they'll use the 2014 adjusted gross income figures because that's what they have on file. If for some reason your income changes drastically, perhaps you retired and your 2015 income went way down, or you're going to be joining Medicare in 2017 and your 2016 income went way down, instead of waiting the 2 years for the Social Security to catch up, you can contact Social Security and provide them with the information they need to show the difference in your income now. And this way they will adjust your rate so that you don't have to wait for the 2-year lag in time. If you did overpay, they do refund the money, but why wait for it? You might as well have it now rather than later. To continue with how much Medicare Part B costs, the penalty I was talking about earlier, the way they calculate it is that there's a 10% penalty for each 12-month period you did not enroll in Medicare Part B when you could have. And I have an example here that Miss Doe, her original enrollment period ended July 2013. Her 7-month enrollment period ended July of 2013, and she did not enroll until October of 2015. She's accrued a 20% penalty because she waited 26 months to enroll, which included 2 full 12-month periods. And she will be paying that 20% penalty on her $121.80 for the rest of her Medicare days. It never goes away. And if the Medicare Part B cost goes up, so will her 20% penalty. Medicare wants all beneficiaries to enroll when they can enroll because they need individuals to feed the money pot to help support everyone who is on Medicare. They don't just want people enrolling when they get sick. They want you to be participating the entire time. Your Medicare Part B costs are typically deducted from your Social Security check. If you're not collecting Social Security, you will be billed for the premium on a quarterly basis. So how much is Part C? Well, this is sold by private insurance carriers, so the premium varies. It can be anywhere from $0 to $128 for the year 2016. It could go up, at any time during open enrollment. It includes Parts A, B, and D, and you still have to be enrolled and be paying for Part B. And how much does D cost? Well, that's also sold by private insurance carriers, so the premium varies. It can be anywhere from $18.40, again in the year 2016, up to $104.70. You could have a monthly adjustment based on your income, another income-related monthly adjustment amount. It would include your plan premium based on your IRS tax return and the fee for your adjustment. And Medicare Part D also has a late enrollment penalty. Again, they want everyone who's eligible to be contributing to the Medicare pot to help pay for everybody. If you don't take any prescriptions, the best thing to do is just buy the least expensive plan on the market. That way, if you get an infection and need an antibiotic, at least you have some coverage, and then you're prevented from being penalized for not enrolling. There is, with the drug plans, what they call the coverage gap or the donut hole. And it's explained here on this slide. This is for the year 2016. So say you pay your yearly deductible of $360 for your drug plan, and then the plan starts to pay its share. So in the example, Mr. Abernathy pays a copay, and the plan pays its share for each covered drug until between the both of them, Mr. Abernathy and the insurance company, plus the deductible, reaches $3,310. During that time, you or Mr. Abernathy would be responsible for 45% of brand name drugs and 58% for generic drugs. The insurance company would pay the rest, and again, you keep adding the amounts for what you pay and what the insurance company pays. And once that total reaches $4,850, Mr. Abernathy or you will go into the catastrophic coverage bucket, in which the price of your copay for each covered drug is quite small, anywhere from $3 to $7, until the end of the year when it starts all over again. Now the donut hole is going to be smaller each year. Next year's figures will start at a higher amount and will end at a slightly higher amount, but the time in the donut hole will decrease. And by 2020, the donut hole will be gone. There also could be costs for other types of plans, just to be aware of: deductibles, co-payments, co-insurances. There could be other fees. Doctors who charge more money than most doctors. There can be non-participating providers, where you'd be responsible for a higher percentage of the cost if they don't accept Medicare assignment. And then you have private providers who accept no insurance, and you would be responsible for that total cost. Lots of times people wonder, well, who's going to pay first in this coordination of benefits? Who pays first? Well, it depends if you're actively working or you're retired. If you have fewer than 20 employees, Medicare is going to pay first. And you have to have Medicare Part B, and that will pay second. Typically, the HR department at the company will let you know whether or not you need to start participating in Medicare Part B in order for the employer insurance to work properly. If you have 20 or more employees, the group health plan pays first. And that's why most active employees in larger companies do not join Medicare Part B, because the benefits are usually rich enough that you don't require it. Once you retire and you receive retiree benefit insurance, Medicare is going to pay first, and the retiree insurance will pay secondarily. That's why the cost usually goes down a bit, because the company is not assuming such a high cost for the benefits. Okay. So this concludes the presentation, and there's a couple resources if you need them. You can always go to Medicare.gov, which has lots of excellent information. And each state has their own SHIP program, the State Health Insurance Assistance Program. Up on your slide is the one for the state of New Jersey, but from Medicare.gov, you can find the one appropriate for your state. And another very helpful resource is Social Security or SSA.gov.